by region. And so that does mean some legislators, because of how their legislative districts overlap counties, may in fact need to sit in on more than one if they want to see their full legislative district. We just couldn't figure out an easier way to do this, and so this is what we settled on. But like Mitch said, we will be sending out a copy of the video and a copy of the slides and some notes from the video. And then at the end of all of them, we'll figure out some way to synthesize what we've heard and put that together. So what we plan to do today is spend about 20 minutes hearing from Public Health, Mr. Melnick, and then we will move into about 25 minutes, 5 minutes for each county. And you can see we have Clark, Cowlitz, Lewis, Pacific, and Wahkiakum on the call today. So we'll spend about 5 minutes for each county to talk about the impact the pandemic has had on their county and how their response has had an impact on county functions. And when we get to that slide, you'll see we have some examples on there, but for each county, it's really going to be different. And so that's why we wanted to make sure you had a chance to hear from everyone. After that, then we'll spend another about 25 minutes looking ahead, 5 minutes per each county, for them to talk about what they see moving forward for their counties. And certainly we're hearing a lot about budget concerns. One, because of the expense of responding to the pandemic, but two, because of how vulnerable Washington is in terms of being sales tax heavy to a recession when people aren't shopping, and just, you know, the lockdown on businesses and things like that, and how it's affecting revenues moving forward, but also things like what the counties can be doing to help move everyone forward and what might they need to assist them in making that happen. So we'll spend a few minutes on that, and then hopefully if we keep to our time frame good enough, we'll have 15-20 minutes at the end where people can ask questions. Please, though, feel free to type them into the chat box just in case we run out of time. That's a great way to make sure that we do cover them. And with that, I am going to turn the floor over to Jamie Bodden. Jamie is the Managing Director of WASOLFO, the Washington State Association of Local Public Health Officials. So she can get us started with introducing Mr. Melnick, and we will go from there. So take it away, Jamie.
Thank you, Melanie. Much appreciated, and thank you for the opportunity to highlight a lot of the local public health work that we've been doing across our state. Our local health jurisdictions have been on the front lines of this response since January. You'll recall I saw a lot of our legislators in Olympia in January and February, and I talked to you about coronavirus even back then, before we had the case count that we have today. So they have been working for this for a very long time, putting in some very long hours, and I am just so very grateful that we have our local public health system that we do in the state. It is my pleasure and my honor to introduce Dr. Alan Melnick. He is the Director and Health Officer for Clark County, and then he is also the Health Officer for a number of our smaller counties in southwestern Washington, including Cowlitz, Pacific, Wahkiakum, and Skamania. So with no further ado, Dr. Melnick, take it away.
Thanks, Jamie. I was going to go ahead and introduce the whole region, but you did it for me, and it's really a great region to work with, and really have great partners. And I have a deputy health officer who helps cover all the counties, so that's how we make it work. I'm on slide 1 now, and I'm going to take a look at my notes here, but we didn't just learn from Ebola. We had the misfortune of being the epicenter of the first measles outbreak in the United States last year. So we learned a lot of lessons from that. We also learned some lessons back from H1N1. And one of the things we did was we implemented incident command pretty quickly. One of the challenges that we've had, and I think other counties have had is that we've lost staff over the last, decade or so due to loss in state funding for public health. So the resources we had have been limited to begin with. And during measles, we had a lot of help from the outside because we were the only ones experiencing it, and we were able to get a lot of help. This time, everybody was in the same boat, so there's not a lot of help from the outside. By standing up, we've already had great partnerships with emergency management and healthcare, and I'm going to talk about Clark County right now because I'll let the other counties, I think, I get a chance to speak. But we've already had great relationships with our partners, and certainly our experience in the past has helped with that. But standing up the incident management team really early on, and that was in early March. That makes it easier to work with partners because you have the liaison function, and it makes communication and coordination a lot easier. Early on, we were looking at, and I'm taxing my memory here, but early on, the drill was to monitor travelers. You might remember that it was Wuhan and then Hubei province that Wuhan is in. Early on, we were getting a list of travelers from that area, and then we were monitoring them for 14 days after they arrived. In really early March, we had our first positive case in Clark County, and this set off the alarm because this was an elderly male without any history of travel, and what that told us is that the disease had arrived in Clark County. It was acquired locally, and things moved fairly fast after that. The governor declared an emergency in late February, and even though the governor's emergency, according to our prosecuting attorney, covered us, I think our county wisely declared an emergency it was early to mid-March. I don't have the exact date, but we declared an emergency. Our council, our Board of Health, declared an emergency as well. We continued to work across the region. We adopted the CDC and Department of Health guidelines. We put those guidelines on our webpage, and we put out multiple provider alerts. And the provider alerts not only included what to consider clinically, but also how to get where to get testing done, how to get testing for the patients. In terms of communication, at first, Board of Health meetings. I believe sometime in later March, we began the Board of Health, our county council, asked for more frequent meetings, which we're delighted to do, and they became bi-weekly. The other point I want to make is we received great support from our Board of Health, including advocating for foundational public health services and COVID-19 funding. I got to tell you, with the funding challenges, we received a little bit over $1 million earlier this year for COVID-19, and at our current burn rate, that will last until like June, July. So funding is going to be continue to be a challenge. At first, the other challenges at first, and I'm sure you're all aware of this, has been personal protective equipment as well as supplies, and the testing supplies. And the lack of testing supplies made it really challenging in terms of getting testing. At first, it was restricted to the symptomatic travelers. Then we expanded testing to the CDC guidelines said you could test patients admitted to the hospital. And later on, as the disease spread, the guidelines said that you could, physicians could test at their discretion. If they felt the patient needed testing, they could get a testing. But, and we sent out a provider advisory telling physicians they could do that. And we even gave them directions on how to submit early on there was a bottleneck because you could only submit through the public health lab, and that was the testing was limited. Later on, UW came online and private labs came online, and we put out these provider advisories saying, go forth and test, and nothing happened. And it became pretty apparent quickly on is that providers weren't testing, not because they didn't want to test, but because testing supplies are really limited. Still on slide 2 here, I just want to mention that communication was key all along. We used social media as well. Our webpage, we're continuing to update it every day at 11 a.m. with new numbers. We put out information for county residents as well as guidance. We have guidance on our webpage for business, for schools, for food establishments, healthcare providers, and others on our webpage. Okay, that was slide 1. I'm sorry. I'm going to move to slide 2. So we realized, early on in early March that transmission was occurring in our county. When around case investigation, and when the numbers began to increase, given the lack of resources that we had to really modify our contact investigation process. And this is going to be an ongoing discussion in terms of how we gear up next month for a more intensive contact investigation. The gold standard is when you have contacts, when you have a case, you interview the case, find out who their close contacts are, and then you monitor, you quarantine the close contacts, and you monitor them actively for 14 days in terms of calling them every day. As the numbers went up, we had, even with additional staff that we had and volunteers, for example, we were able to use school nurses as volunteers because they were not, schools were closed. We still had to modify it so that we were, for the lower risk cases, we would just give them information to give to their contacts about self-quarantine. For the higher risk cases, like healthcare workers, residents or staff of long-term care facilities, people in other congregate settings like jails, we would actually we would not only interview the case, but we would find out who their close contacts are, and we would directly give the close contacts the quarantine information. We don't have the resources to do the active monitoring. In terms of looking at the questions, are we seeing a leveling off? Right now, as of today, we've had 327 cases in Clark County with 19 deaths. In terms of figuring out, where we're going with this outbreak, we look at a number. I don't have time to get into all of them. I know I'm speaking fast. We look at a bunch of metrics. We look at percentage of tests that are positive. We look at emergency department visits and hospitalizations for a coronavirus-like illness. And we look at the modeling data. So we don't rely on just one piece of data. If you want to hear more about this, you can go to our the Clark County website, and I gave a detailed description of this at the Board of Health meeting a couple of days ago. We're given our concerns about particular populations. We're really doing more intensive work with long-term care facilities and the unhoused population. So currently with long-term care facilities, if we have one case in either a resident or a staff member, we're working with one of our partners, the Vancouver Clinic, to test everybody in those facilities, staff as well as residents. We're also working on, with the Vancouver Clinic, on testing unhoused populations in the shelters. And we're working, and for those who test positive and their close contacts, we're working with the Department of Community Services. We've set up isolation and quarantine facilities in a local motel. In terms of community measures, we provided, there's guidance on our webpage for example, for restaurants. Our food safety staff are helping there. Around additional measures on parks. We did not close the parks, but we closed the bathrooms and the play areas. And actually in Skamania County, we had to close Dog Mountain Trail because of too many people congregating there. And in Pacific County, we had to close the beaches. There was people weren't respecting physical distancing there, and we used a health officer authority to do that. So in terms of the questions on how we're working together, I think we're working well as a region. We're working great with our partners. The Vancouver Clinic is helping out in the testing. Peace Health Southwest is actually helping out with infection control in long-term care facilities. They've gone in and helping with them. And Peace Health is also going to be providing primary care assignment for our unhoused population in isolation and quarantine who do not have a primary care provider. We're also working with school nurses. They're volunteering. And in terms of communication, we've got where our PIO is working with our partners to coordinate messaging. We just got one out with our healthcare news release out with our healthcare partners to encourage people who have other serious conditions who need to go to the emergency room to do so, that it's safe to do so because we were concerned that people weren't getting other things attended to. We've also got on our webpage and in social media, we're using multiple languages. Slide 3, the last piece here is, what we're going to need once the restrictions are modified. Big concern we have because this disease can, if we do nothing, the disease, once we remove or restrict physical distancing, the disease can take off again. We're going to need several things in place. We're going to need adequate testing supplies. We're still running short of point of care testing. Those Abbott instant, the results that you get in minutes. Still running short on testing supplies on those. And there's also challenges with those around false negatives that we can talk about if we have time. We really do need adequate funding for a robust case identification, isolation, and contact tracing and active monitoring. If we're going to be able to do that, we're going to need to hire a significant amount of staff, and we're going to need funding to do that. We also use more help from State Department of Health as well as DSHS to help with infection control in long-term care facilities. So that's about all I had. I hope I didn't go over time. I know I spoke fast.
Thanks, Dr. Melnick. We did have a question that I think you're poised to ask now instead of waiting till the end. So we had a question about how Portland is affecting your response. So perhaps you could just touch on kind of the multi-state coordination that you've been doing.
That's a great question. So we actually are part of the multi-agency coordinating group with our colleagues to the south. So we work really closely with them, and we meet with them virtually every day, and we're in constant communication with them. Especially challenges around messaging. I think there are other challenges because our states are obviously two different states with two different state agencies, and actually different statutes and administrative code in terms of what local health counties can do and not do. So, but the bottom line is it works really well, works pretty well, and we constantly communicate with them.
Great, thank you. And thank you, Dr. Melnick, for taking the time out of, I know what is a busy Friday for you, because we have other meetings later this afternoon that we'll be on together. Much appreciated. And again, thank you for all you and our other local health jurisdictions are doing to keep our residents safe and healthy. I know you've put in some really long hours, and I am very, very appreciative of all the work that you're doing. Thanks. With that, I will turn it back over to Melanie to finish us off.
Thank you. And thank you again, Mr. Melnick, for your work. I know I've been on a few calls where I've listened to you speak, and I know you're working really hard, and we do appreciate the time that you took today and everything that you're doing. Why don't we then move on to how has responding to the COVID-19 pandemic affected county functions? And again, like I said earlier, I put some examples on the slide, but county by county, it's probably totally different. Yesterday was very telling with the counties that we were on the call with in the northwest corner of the state, where we had a lot of trouble communicating because their broadband system is just really bad up there, and it's affecting their ability to do work. In other areas, it's going to be something else entirely different. So we have really enjoyed, or at least I have really enjoyed, this opportunity to hear from each county on what they've been doing and what the effect has been. So why don't we start with, just in order of how I jotted the counties down on a piece of paper, do we have anyone from Pacific County on the line?
Melanie.
Oh, there we go. I was gonna say, if we do, you're muted.
Sorry, I was trying to figure it out.
Yeah, go ahead and maybe spend a few minutes talking about what all this has meant to your county.
Our county is one of the, I think Skamania has a certain amount of tourism, but probably one of the only ones on the call that has such a tourist-centric base, especially at the south end. We're looking at pretty severe impacts to our tourist industry, our motels. We voluntarily shut down our motels and hotels after everybody came to every coast there was during that March clam tide. And so all the businesses that surround that, the construction, which I hope the governor is going to put back on back to work today. We have been very lucky so far to not be terribly impacted with the actual virus. I think we're at 4 cases. 3 of them are in county. 1 of them is on the East Coast, but is a resident, so it's in our column. So right now, we've just been putting in a lot of time. We're worried about revenues. Sales tax, interest income is non-existent. We're worried about revenues and how that's going to affect us in the long term. I don't want to drone on. I'll just stop there, and if there's anything anyone wants to add.
Well, thank you. I think you might win the award for brevity, but you're probably saying things that everybody is feeling. So I appreciate that. If we're good, we'll move on to the next county, and we'll come back to you in a few minutes to talk about moving forward. How about Lewis County? Do we have people on the line from Lewis?
Yeah, hi, this is Eric Martin, County Manager. Can you hear me okay?
Yes, good morning.
Morning. Hey, so I'm going to focus a little bit on operations. I think our budget administrator as well as the county commissioner's on with us here, so I'll be real quick. Yeah, just looking at your list of things, we have used the Commerce Grant to set up a congregate housing facility at the fairgrounds, which we've gotten pretty good response to. I think we've had anywhere from 8 to 18 individuals that have been there just as sheltering, as a safe place to be for them, homeless folks. For our solid waste facility, we've limited it to in-county only because I think Thurston County had shut down their transfer stations, and we had an influx, huge amount of people that came to Lewis County to get rid of their refuse, and it was causing some serious social distancing issues. So we've closed it to county residents only. Broadband has really come to the forefront. I think it was something we already knew was a problem in Lewis County, but with trying to get our employees working from home, it's been a struggle in a lot of offices. So we've had to sort of balance that between, are we going to provide those essential services to the people and ask people to come into the office, or are we going to, reduce services? And it's been some of both. So we, from a community standpoint, we've had a large outpouring of community folks in our area trying to get meals out, especially to vulnerable populations like seniors. to help them stay home. And so we've had a great outreach from a whole coalition of folks, including our senior services folks, our transit folks, some of the other social services groups in our area that have been working on that. Lots of other things going on, but I'll turn it over to Commissioner Fund or Becky Butler to talk a little bit about finances and other community issues. Becky or Edna, are you on?
If you are, please unmute yourselves because we can't hear you.
So I'll just add one little piece about budget since I'm not hearing Becky. We have organized we call it the Financial Impact Team, the FIT team, and it includes our auditor, treasurer, and the prosecutor, as well as myself and our budget administrator, to work on sort of looking at what our financial impact might be from COVID over the next months and years, and what kind of measures we might want to recommend to the Board of County Commissioners to deal with that. So we just sort of scratched the surface on those conversations, but you know, we're kind of trying to look at what is the contingency planning, what are the scenarios that might come about from this, what are the lost revenues that might come about from this, and how do we want to respond to those different scenarios. So we're working diligently on that to try to plan for what might happen. We're not sure yet, but we kind of want to be thinking about that. I think a lot of other organizations are doing the same. So I'll leave it there.
Thanks, Eric. And now I see a screen that says Becky Butler on it.
Yes.
Can you hear us?
Can you hear us?
Yes, we can. Thank you.
This is Edna Fund, Lewis County Commissioner in the historic Lewis County Courthouse. And it's been quite the trial for us. And as we look at some of the issues that are when we look at financial issues, the 1/10 of 1%, which we use for a lot of mental health issues. And we know COVID-19 will cause a lot of mental health issues. How are we going to respond without that? Our manager mentioned broadband. I have a memo from our 7 school districts saying we need broadband. Our kids out there do not have access to broadband, and they provided them Chromebooks, but they don't connect anywhere. There are some folks that have a connection, but it's so slow. If they have 2 kids, it's brought down to a halt. So it's very difficult without that broadband, and broadband also can be very helpful as we do telemedicine. We have a lot of rural areas, and so that is a very difficult issue for us. Another piece that we did, which I think is a very positive piece, we put together Lewis County Together, which is a website and a Facebook page that talks about the resources we have for health, for business, and county functions. So it's been a big deal for all of us as a rural area that we're used to doing rural things, and when we can't go anywhere and can't provide services, it's difficult. And I'd like to turn it over to Becky Butler, our finance manager.
I think Eric covered a lot of it. One other item that our Public Works Director wanted me to mention was the concern and loss of motor vehicle fuel tax and the impact that will have on deferred road projects and maintenance along that lines. The mental health tax, tourism promotion, .09 funds all rely almost 100% on sales tax, and so anticipating a large decrease in those funds and what programs may have to be cut if we don't receive additional funding to cover those losses. And I think Diane Dory is also on the line. I don't know if she wants to add.
This is Edna Fund again, just to say we have Dr. Wood as our health officer, and at this point we have 25 cases and 3 deaths.
Thank you very much, both of you. And we are amassing a queue of questions, which I think is fantastic. We are going to hold those until the end because it gives me a great excuse to cut everyone off so we have time for the questions at the end. But do we have anyone else left from Lewis County?
We have more time?
No, not right now.
This is Diane Dory, Lewis County Assessor. And of course, I want to address the fact that the stop of construction in the state is going to have a huge impact on the new construction dollars that go to each taxing district. Not only counties, but we have 65 taxing districts, including fire, cemetery, library, all of those will be impacted by the amount of new construction that was either stopped from starting or stopped in midstream. And I don't know whether or not we'll be able to get all of that picked up in a timely fashion anyway. So that's very concerning to me, and I'm sure the other 38 assessors throughout the state have the same concerns.
Yeah, and we definitely have some questions about showing up about how counties are going to start estimating their short and long-term revenue impacts. And so I'm hoping we'll have time at the end where people can chime in and talk a little bit about that in specific. And maybe as we're also talking about moving forward and your anticipated needs, that's a great time to also address that question. And I would just say from a personal perspective, even though I don't live in Lewis County, I did take a look at that website and I think it's fantastic. And I know that it was a labor of love and took a lot of effort, but I really commend the people who put that together. I think it's a great resource for your local citizens and your local businesses. So kudos on that. And with that, let me turn it over to Wahkiakum. I think I saw at least 2 people on the call. So maybe we can unmute Wahkiakum and let us hear from you.
Good morning, Melanie.
Good morning.
This is Gene Strong from County Commissioner. Yeah, this is kind of interesting times, and I appreciate that. One thing I want to say is Chris Bishop from Health and Human Services has just been doing a great job. We have Monday, Wednesday, and Friday mornings. We have a department heads and meeting and talks about what's going on, what's happening, new cases, and just keeping everybody updated on what's going on. And that is a great thing because we're hearing and hearing it right before a lot of it goes out as press releases. One of the things, I think a large thing, I think everybody's really like, is the stress. And the stress on the department heads and the stress on the employees as they're trying to figure out this, working through this, social distancing, working remotely, the challenges with broadband that it has because a major portion of our county, I live in an area of the county that has great broadband. I have fiber optic to my house, which is great, but a lot of our area doesn't have that. And that creates a real burden for trying to work remotely. I even heard back from the business community where they're trying to do mandatory reporting and they can't do it because we're limited on how they can do it because of that lack of the, good broadband services. I think on our operations somewhat is cutting back ferry runs, which ends up impacting the revenues on the ferry. Public Works, we're working them, one crew working, 1 week and then off a week and the other crew on, which ends up cutting back on the work that they're able to do, not able to do a lot of the seasonal repairs. The assessors come in and had to put inspections on hold now. And then again, within the courthouse, and I think everybody realizes this, the lack of space in the courthouse to be able to have the social distancing in there so people can come in and do it. The auditor was talking about that yesterday, the day before, about her ability to be able to have, she can't have the people in necessary to do the work because of the social distancing. So again, the ability to operate it, at acceptable levels. Even with a shut office, you still have a certain amount of level of service that needs to, you need a personnel in there to do the work. So again, that's kind of, and then early on and still even today, testing supplies, even, and I think in the smaller counties, we don't have the personnel to do the test, even if we had the test kits. So that is something we really need and going to be needing moving forward to be able to do adequate testing is, personnel that can come in and do these tests. even when we have the test kits, we're going to need somebody to come in and help with the testing. And with that, I'll turn it over if Chris has something he wants to add.
Chris, if you're on, you're muted because we can't hear you.
Sorry about that. I was muted in two places. I'm on. Let me try again. Can you hear me now?
Yes, sir, we can. Thank you.
Thank you. Thank you, Gene. A lot of what he said, obviously, all of what he said. Edna Fund, also from Lewis County, hit on a lot of points that we're having issues with. Rural broadband at this point is really just a massive hang up. We run a behavioral health clinic as well as being in the health department and trying to do telehealth with people that just can't get access either through technology or through lack of broadband. I talk every day with our school superintendent, and they, similar issues with trying to do that distance education. They actually purchased some Wi-Fi hotspots that use cellular services. That's great, but there are also places in our county that don't have internet and also don't have cell towers reaching them. So then you're just kind of stuck with this. Well, is there some way to get them in closer to town, kind of undoing that good? For us as an agency, I think, we've responded very well in Wahkiakum. We're fortunate to only have 2 cases. Certainly we're worried about revenues. It's a timber county, and with the timber markets in serious dire straits, that's a problem for our whole county. Just having the technology available and the people. A big problem for us has been testing. We have one small clinic. They don't have a ton of capacity, and many of our residents don't use them. And so we've worked with that clinic to be able to test people that aren't normally their clients, but it's very limited at this point. I think during this entire thing, we've done less than 50 tests, and I don't feel that that's adequate, and I don't feel as that will meet our needs going forward. So we're going to need real help from, and my thought would be from a state agency to help us do testing. We just don't have the personnel and the capacity to do much more rapid, widespread testing if we're going to start opening things back up. So I think those are my big issues. Thank you for the time. I appreciate it.
Well, thank you for the time. We appreciate it. Anything else from Wahkiakum County, or should we move
this
on?
is Mike Backman.
Good morning.
Yeah.
Go ahead.
Right now, with the slaughterhouses being shut down, we have a lot of farmers that aren't able to sell their animals, and so we're having this is a perfect time to push for more WSDA assisted, so that we can build capacity and spread out the processing. I know it won't be today, but we need to be pushing that so they can see the weakness in the system of by having all the meat go to certain packing plants. It really affects the rural counties because a lot of people here are being told not to bring their animals to the market to sell. And so they're seeing a real reduce in price, and we just want to make sure that the legislators understand that when they go to figure out how to help the local area so that our farmers don't get left behind.
I think that's a great point, and it's not one that we had heard on a call yet, but certainly we have seen in the media. So thank you for bringing that up. I really appreciate it. Moving on to Cowlitz County. I'm pretty sure I saw people on the line from Cowlitz.
Yeah, hello, this is Joe Gardner, County Commissioner from Cowlitz County, and I know Cowlitz has, I think, a pretty good showing, at least from what I can tell, so I won't take up too much time. I'll allow others to chime in. I'll touch on a few things specific to impacts to county functions, at least that I know initially were big issues, and I think they've plateaued a bit as we've addressed them, but several HR related, we right out of the gate had lots of inquiries and questions around leave and what was acceptable use of leave around coronavirus. And I know that changed a bit once the new federal law that allowed for or provided for 2 weeks of leave came into effect. That did relieve some of that, but HR had to deal with, were inundated with questions revolving leave-related issues. HR and IT both had a lot of work getting folks set up to work from home, and HR established work from home agreements, and IT was extremely busy getting a lot of staff set up to work remotely from their homes. The other big factor, of course, I'm sure everybody's dealing with is just the logistics of department interactions with the public who are extremely comfortable and used to walking right in and having transactions handled in person, face to face. Of course, that all changed pretty much overnight. So departments, I think, had to scramble to react to that, and it was a big push. But I think, we've gotten to a point where it's not maybe the perfect situation, but we have dealt with those, I think, as best we can. But we have heard about that, and I think continue to hear about that, and I'll let other departments or elected officials chime in on any of those specifics. And then, of course, budget considerations. There's been things that come up where now everything's getting revisited. Even though they were in the budget from last year, that doesn't really mean much now. So we're revisiting items that were already budgeted and taking much harder looks at things that we would just assume have happened. So I know we've had our finance director try to put together some projections and use his magic crystal ball to give us some ideas of the shortfalls or in revenues that we might be seeing in the future, and that's been helpful. But it's still rather unclear. The crystal ball is a little murky, of course. I assume that's the way for everybody. But as I think we start to see sales tax numbers trickle in now, now that this has been going on for a while, I think that'll help make the picture clearer. And then I noticed several people talked about broadband. At least for me personally, I haven't had a big public input about broadband. I haven't heard of issues within county operations having issues with broadband, but I did hear from one citizen who was concerned because of school-related issues of doing online classes and whatnot, and they lived in an area that had nothing for broadband, or at least extremely limited. And I do know, I live in a very rural part of a rural county that our school district, Toutle Lake, I know other parents have been dealing with, not the greatest internet, but I don't know, at least what I've told folks, I don't have a magic wand to wave on that front of issues, but I do know that it has been an issue for some folks. I just haven't heard a huge outcry. My phone hasn't been ringing about that too much. It's been mostly items related around the shutdown of the economy, and also hunting and fishing are kind of our at least two biggest, I guess, hot button items at the moment for me regarding emails and phone calls. So with that, I'll cut off my time, and I'll turn it over to anybody else from Cowlitz who wants to chime in. Thank you.
Thank you. Anyone else from Cowlitz? Okay, I am not hearing anyone. Unfortunately, I don't know if that means you're on mute or that we don't have anyone. So I'll give it just a second and move on, talking slowly just in case someone chimes in.
This is Carolyn Fundingsland, Cowlitz County Auditor. I just didn't want to chime in at the same time somebody else was chiming in, so I was giving it a second.
Ahead. Yeah.
So I don't have a lot to add. I was just going to give a perspective from the auditor's view during this pandemic. Cowlitz County is one of what we're coining the April 10 of us in the state that are conducting elections this April for school districts that have previously failed their levies, which is a big issue and very important. So like some other counties that have chimed in here on this call, we have a logistics issue in which our space is so small that we are not able to social distance, and yet it's an essential service. We have to be here and we have to process ballots. So like everyone else, we're doing the best that we can with what we have. I can say that for these school districts that failed their levies this February, at this time during that election, we had a 28% turnout in that election. And right now we're sitting on a 42% turnout. I don't know what that means for the districts, but very definitely unusual. So another point that I guess I'd like to bring up is that all elections offices are getting a surplus of additional CARES Act funding that has a lot of restrictions and has to be spent by December 31st to plan for response to COVID for our fall elections. And that is going to be a tremendous challenge for all of us. And we are meeting regularly trying to come up with ideas. And I can tell you that because we have such a logistics issue here in Cowlitz County, the only way that I could see spending that money is to move to a larger space. And I've even heard of other counties looking at purchasing a motorhome to make a mobile voting center. So just thought I'd share some of those ideas.
Well, I have a question for you. I don't think you touched on it, but if you did, I apologize. How are you addressing same-day voter registration in this new era of social distancing?
So while our doors are closed to the public, we are here and continuing to serve the public by appointment. So we have a drop box out in the hall with a self-help counter, so everything is out there, and if they need assistance, there's signage out there that says, please call our office, and then when they call, we meet in an area that has a window that separates the two of us. It is not convenient, but with this small election, we are conducting a very small election. It's working. It won't work for our fall elections. And right around the corner is candidate filing week. We all have precinct committee officer positions. Each precinct has a Republican and a Democrat party candidate usually, and the parties bring in droves of these PCOs to file for office online. So we are trying to get the message out there that says, hey, please respect social distancing laws and try to file online if you can. Basically, all that said, we're winging it the best that we can with what we have.
I think that is a great summary for how everyone is really handling this, is winging it the best we can, but really appreciate the feedback. And since not every county is dealing with an election right now, I appreciate it when we have the opportunity to hear from those who are. Moving on then, and we are slightly behind time, but we're not doing too badly. Let's move to Clark County, and I know we have at least a couple of people on from Clark.
Good morning. This is Ida Quiring, Council Chair. And what Clark County is doing is, abiding by what the proclamation of the governor gave to us, which, of course, our meetings as a council are all being held by WebEx. Any communication that we have in other meetings that we have are either phone or similar to this Zoom meeting. We also have closed down all of our in-person activities at the county with various departments and moved it to online. We've closed play structures and parks. Let's see, we've adjusted our employees' various schedules so that there is social distancing for those who actually are coming into work or doing their work, like Public Works, etc. We're trying to adjust those schedules, and we're keeping an eye on other things with employees to make sure that we're, that the work is getting done, or if they need to not be at work because they're ill or something. So we want to take our utmost care of our employees while this is going on. Budgetarily, we are going to be suffering. At the very minimum, we'll be $5 million short, could be up to $20 million short. Just reminding you that we're a border county. And border counties already have a shortage of revenue coming in because there is the opportunity to go across the river and not pay sales tax. And so people do that and often do it on some of their larger purchases. So as well as, and I know it was mentioned by one of the other, I think, elected officials, if not one of the other officials, because of the construction or new construction, it is a large portion of our sales tax revenue. And so that is because that has not been going on, is depleted somewhat too. We're working hard to carry out our duties as a county, and so we're doing what we can during this. We're ready, I think, to hear from the governor about how some of these, what metrics will be used to, for instance, to release some of us or the state of Washington from this stay home, stay safe criteria. I think that's it.
Thank you, Counselor. Anyone else from Clark County would like to weigh in?
Hi, yes, this is Temple Lentz from the Clark County Council.
Good morning.
Let's see, so some of the other things to follow up on what Counselor Quiring said, with regard to the homeless and housing, we did receive, Dr. Melnick mentioned it early on, and actually I'm even going to stop myself to just say that Dr. Melnick and his staff have been doing such a fantastic job for us. And just, I don't know if you're still on the call, Dr. Melnick, but just wanted to do another thank you. We received about $1 million from Commerce for support of our unhoused population. And the majority of that has gone to securing a motel that the intent was to have it serve for quarantine and isolation for those, for homeless folks who did contract the virus. Thankfully, because of social distancing and efforts to keep it under control, we haven't had, so far at least, the volume of cases in the homeless population that we were concerned about. So now our Department of Community Services is doing a slight pivot to adjust within the parameters of that grant from Commerce, but to use some of this motel housing for the unhoused who are unable to isolate. They may not have COVID yet, hopefully at all, but they still need to isolate. So they're working on that pivot so that we can make sure that we're using those funds wisely and well. All of that said, those funds were supposed to stretch through September, and we're concerned that, like most of the funds that we're receiving, they're going to run out sooner, and their projection right now is the end of June. On the budget, in addition to the general fund hit that Councillor Quiring mentioned, we are also seeing some of our other funds, and it's hard to predict what that's going to be. I mean, one example that was also mentioned by another county earlier was the 0.1%, the mental health sales tax. Unfortunately, a lot of our behavioral health programs are really dependent on this fund. And it's what we use to fund a lot of both our internal work within the court system and the jails, but also a lot of external contracts. So we're very concerned about what that is going to look like moving forward. One thing that we're here, thankfully, as far as broadband goes, we do have some rural areas of the county that are not as well served by broadband, but overall Clark County is pretty well connected. So we haven't been hearing a lot of that, but we are seeing and hearing that, you know, especially as was also earlier mentioned with schools, with kids who may be doing remote learning, the inequity in that of some kids who are going to be able to have fast access and some who aren't is something that we're going to have to address as a county in partnership with our schools. And with unemployment, we have a lot of folks here who are applying for unemployment. And something that at least I'm hearing from my constituents is, you know, the delay in actually getting through to the system, and then also concerns that the fund may run out, because we've heard about that happening in other states. So I'll leave it there.
Good.
I'd like to chime in as well, Gary Mevigi. First point, I want to amplify what the chair said. For all the counties, we need every county's support. We need all our legislators to support. You know, our tax system, our general fund, revolves around sales tax. So we're all broadly hit, and we don't know the depth of that impact yet. The border county issue, we're singularly the worst hit. We're in the Portland metropolitan area. Large stores don't even carry big items here because they know people are going to go across the river to purchase it. Our construction industry buys a lot of their material in Oregon. We are so gravely hit all the time. We're missing about a quarter of our sales tax. It goes right to Oregon. We need some relief now and in the future. So please support us in that. I just, not as a contrary point, but I represent the largest rural district in Clark County, and I've heard pretty widespread comments about the lack of broadband internet support. And I've been working on that quietly for a while. The other point I wanted to make, we're all similarly situated in another area, and that is, these public meeting laws have really constrained, and the emergency proclamations have really constrained in many ways where they shouldn't, continuation of government. We had a lot of issues going on that we were working very actively on that are not COVID-19 related, but we've basically been, all stop. We are focused on COVID-19 every day, but there are other business issues that the county should be able to take up and work on despite the pandemic. So, that's an issue that impacts all of us that we should all speak up on to reform the public meeting laws and the constraints of some of these emergency proclamations on how they constrain local government. Thank you.
Thank you. Very much appreciated. And I would just note that while it hasn't gotten talked about a ton on these calls, I really appreciated the reference to behavioral health, because certainly that is a place where we are seeing or are going to see some impacts, both in terms of the need, domestic violence, alcoholism, just people kind of feeling a little at loose ends, depression, etc. All of that is, of course, being impacted by the pandemic, and then the ability to fund that need is certainly also being impacted. So I appreciate the fact that that got brought up. We can now move on to our next slide, which is our looking ahead slide. And we've covered a little bit of this already, but this is a great time to talk about budget, talk about the needs that you have going forward in terms of what you are trying to do to be helpful in restarting the community, or well, restarting your community, yes, but restarting the economy. What do you need to be able to help with that? The impacts you see on your budget, staffing, services, etc. Do you see that you'll end up having to lay off staff, for example, as we move ahead, because we know we're going to have revenue problems? Those will all be great things to touch on if you have the chance. And then I just put kind of a catch-all down at the bottom, but I know that I'm curious, but what really scares you? What's keeping you up at night now as we're in such a unique situation moving forward? And let's just reverse the order and move back up. And this time we'll start with Clark. And doing just a quick time check, it's 10:32. We are on the call until 11, and we do have some questions we want to answer. So maybe we can leave 5 to 7 minutes at the end to answer those questions. So just kind of keep that in mind as you're chatting. So thanks. Please take it away, Clark.
Okay, what do we need to help restart our community, the economy? I guess we need direction about what the criteria will be in order for our county to get up and running again. As I had already stated, what's happening with the county budget, and reiterating again that we are a border county, and that exacerbates what's happening with that. Our county manager, our deputy county manager that is now taken over, is doing some really good work with the budget and the finance committee, and continuing to ask departments to see where they can make some reductions so that we can meet this shortfall that will be coming our way. I guess what scares me right now is probably the financial situation more than anything. And otherwise, I would say that's the largest thing. I know that I'm hoping that we can phase in the opening of the county so that there will be very few repercussions from the virus itself. So if we do it carefully, I think that we can do it well. But what's new normal? I don't know. I guess we'll see. I hope we get to a new normal soon. Other counselors may want to say things, even though I don't want to give that permission though. I am not I'm not the moderator here. So we don't have a whole lot of time.
Add a small point, because I've been texting back and forth with Dr. Melnick on one issue, but it's a broad issue. We had, and I think they're machines from Abbott, point of care testing. We had about 50 machines. Really great resource to amp up testing. All of them are idled except for about 5 because we don't have the testing supplies. And the texting going back and forth between Dr. Melnick and I are, well, where's the choke point? I don't know where it is right now. Abbott evidently manufactures the machines and probably the components, the supplies that go with it, yet we don't have the ability to contract directly and purchase them. So there's something with contracting, the logistics train, I don't know if it's state, federal, with the manufacturer itself, but that needs to be fixed because we could greatly expand our testing capability right now for COVID-19 if we had supplies. Thank you.
Great point. Thank you.
And this is Temple, also from Clark, and just a couple other things related to moving forward. Some things that our staff are talking about and thinking about are, as our courts reopen, we have a huge backlog in court appearances, and also our courthouse with some very small courtrooms. That backlog will probably continue because of the difficulty of implementing social distancing. And so in the court system, as well as pretty much throughout the county agency, if we're going to have to continue to pursue telework for at least some of our departments in order to just try to get back up to capacity, there's potential infrastructure costs as we move forward with that, of making sure that we can actually keep people connected. One thing that our HR department has been struggling with is we have, I think now, a minimum of 5 different types of leave policies, which we very much want our employees to have adequate and appropriate leave, but we're dealing with our own policy, state policy, federal policy, and the situation exists that with all of the available leaves that we have now, we could have somebody gone for multiple months, even up to a year on a projected leave, but we're not able to really deal with that. And so our efficiency as a county is going to suffer. So one thing in moving forward to possibly the state in putting out any additional leave benefits, to maybe work with the counties on developing parameters for application, so that we can make sure that folks have the leave they need, and that we need to keep people safe, but that we're also able to keep the work of the county going. And then with public health, we definitely need more testing supplies and PPE, and also the funding for the contact tracing that is going to be crucial to being able to get back to work. Thank you.
Thank you. And you raised a couple of great points that we haven't really spent a lot of time on, in terms of the court backlog, which county clerks certainly have raised as a concern, and the HR issue. I know we've received a ton of questions on what's the right choice and which one should you use first, or how do they all work together. And so it's terrific to have all of the options, but it's definitely added a layer of complexity, especially for the counties that don't have a robust HR staff that would be experts in that kind of thing. So how about Cowlitz County? And I'm afraid we're going to run a little over. We have about 10 minutes left, but there are some public health questions that have come up that I think it would be great to have Dr. Melnick and Jamie answer. But let's run through the other 4 counties really quickly. And then if people can stay on for a couple of extra minutes, let's plan to do that. So Cowlitz County, moving ahead, what's on your mind?
Yeah, this is Joe Gardner again, and I'll be really quick. So the first up is regarding opening back up, is what that looks like logistically and being able to open up safely. Other people have touched on that, but I know just from discussions with our facilities department, there's offices and departments within the county that are already trying to predict what that looks like and how to address it with, I call them face guards or some sort of guarding at desktops or countertops where there's direct public face-to-face interaction, and how we handle all of that, because they'll probably think we're getting a bit of a backlog in those requests, along with addressing masks and staff wearing masks, and what do we have enough of that for everybody, and how we meet those needs. And then just in general, it was touched on from Clark County, the backlog issue, because I think not just with the courts but countywide, we'll probably see potentially folks coming through the door who've been just waiting to take care of business until they can come back in the office one-on-one. And then lastly, what keeps you up at night? The economy. I don't think we fully understand yet what the long-term impacts of this really looks like, and it is scary, and how that relates to county budget and the sorts of decisions we're going to have to make coming forward. I know we've got some strategies on kind of a multi-pronged way or options to address it. We've spoke with our finance folks, and I think there'll be some difficult days ahead in that respect. So those are the things that keep me up, and anybody else from Cowlitz, please chime in.
Thank you. Really appreciate that. How about we go back to Wahkiakum?
Okay, this is Gene again.
Commissioner.
Yeah, and I think pretty much what Clark and Cowlitz covered there is a lot of it. I mean, the courts, the backlog of cases coming in, and I was talking to our district court judge the other day, and yeah, and like, what is court going to look like when we come out of that? That's going to be another challenge, is what it's going to look like. How are you going to do that? But also, thinking about things looking forward with the loss of the road tax and the gas tax dollars that we're going to lose out of this. How is that going to affect our ability to complete needed repairs? What about vendors when we start to open back up to getting things? Are the vendors going to be ready to open? Are they going to have the materials that are needed to even do some of the repairs? So these are all things that we're going to be faced with new challenges as we move into the starting to open things up, starting to try to go back to what maybe is a new normal, or we're trying to ramp up into an opening up. So again, the loss of revenue in so many areas, not only sales tax, like I said, road tax, gas taxes, property taxes. There's, and how this impacts everything from us all the way down through to our, junior taxing districts, as we, I know we're going to see them struggling with this as well. So lots of issues to think about, lots of things that when we can't sleep at night, we can think, begin dreaming about what are we going to do. So with that, I'll keep it short. And if Mike or Chris has anything to say, I'll leave it over to them.
Commissioner.
So yeah, this is Chris Bischoff. I think the things that I would talk about, the problem and what scares me are closely related. It's just a testing issue, how you do that widespread. That needs to be something that's done way more than the state has capacity to at this point. So the state DOH is putting out a plan about testing as quickly as possible people who are symptomatic and anyone around them who's symptomatic. That's countries that are really doing this well they test anyone around them, whether they're symptomatic or not, especially since this is an asymptomatic carrier. That capacity does not exist and needs to exist. It needs to be rapid and available everywhere because we don't know where those next outbreaks are coming. Another part of that is just the medical system being able to catch up PPE-wise, just catching their breath-wise before we jump back into throwing a ton of cases at them. And then the other one that's become more clear lately with the potential COVID outbreak at the Foster Farms plant, and again, asterisk potential. I did start looking at that, and right now in the country there are 12 meat processing plants and 3 food processing plants that are closed due to COVID, including the most recent one in the state, Tyson. Tyson is capable of producing enough beef a day to feed 4 million people. They're now closed for a few days while they test all of their employees. So when we talk about opening things back up, that's one of those unintended consequences, is those folks need to be there, they're essential, but it's impossible to distance them very well and still be able to meet their production. And when we put more people back out into the public, we just increase the risk of those folks who are essential, and that is what keeps me up at night.
Great points. Thank you.
Yeah, this is Mike.
Go ahead, please.
I can't stress enough, I wish there was a plan so we could see where we're going, so we could show people the increments of why they're doing what they're doing, because they're so frustrated and so scared that they're going to lose financially that they're willing to risk this pandemic to our vulnerables. And so that keeps me up, because it's a fine line, a dance between keeping your county solvent and keeping your county alive. And it's very frustrating because you're stuck in the middle there where you can see both sides. We're paying attention, we can know. And so we'd like a message to the governor: do what you need to do to keep us safe and get us working safely, and do it in a manner that people can see with a plan coming.
Yeah, I think that's a really good point. I think people are getting antsy and anxious, and even if it's a long way off, just having some kind of light at the end of the tunnel would be helpful. So I think that's a great point. Lewis County, let's move to you.
This is Eric Martin. I just want to touch on one point. I'm going to turn it back to our commissioner and our budget administrator, and that is I really urge legislators, the governor, and those especially health officials, and I hope the doctor's still on the line, to weigh the impacts that this is having on behavioral health. And I think, Melanie, you touched on this. When kids aren't in school and when people don't have jobs, the whole community health just goes spiraling downward, and it could be much, much, much worse than any virus. And so I just ask that please, you consider those health impacts as you're weighing how we reopen, when we reopen, safely, of course. But those are things that could have long, long lasting impacts that go way beyond any one particular disease. So just a plea there to you consider and weigh those factors when you're making decisions. And I'll turn it back over to our commissioner.
I'm just going to touch on the county budget staffing services. Obviously the funds that are, again, dependent on the sales tax are focused right now on figuring out what programs are within those and being paid by those sales tax revenues, and then getting people together to talk about what goes off first, which is unfortunate. Obviously laying off employees is weighing heavy on everybody right now, but if there's not additional revenue and no help from the federal government, then that's the only choice we'll have. We need more options. We need flexibility with revenue. That would be very helpful. We're still down employees from the recession, and our fund balance never came back up from the recession. So we're starting at a lower point than we were then, and the impact of this will probably be far bigger than that. So those are some of the issues that we're facing.
This is Edna Fund. What keeps me up at night is the faces of our county employees that we may have to lay off if we're looking at reduced sales tax, other revenue. Could be 200 people, maybe close to 600. And thinking about our citizens who depend on us to provide services, and how do we do that? We have more people who are laid off. They need behavioral needs. They need money. When I think about our small businesses, when I talked to the Centralia Downtown Association this morning, what do you need? And they're at like, I don't know what I need because I do not know what's in store for me. And when I think about the projection of 35% of our small businesses go down, that brings nightmares too. So there's a lot to be thinking about 24 hours a day. And I just hope when we hear the governor at 11:30 today, part of that issues that we're working on may be resolved, but we got a long road to go. Thank you.
Thank you. Let us move, let's see, that was Lewis. So last but not least, Pacific, and then we will get to some questions.
Hi, Melanie. Just a few things that are on our plate. We are a border county also, so we have Astoria right across the river with no sales tax. We have approximately $11 million budget that we've done some projections, and we could lose easily in revenue a little over 2 million. Hopefully that's being pessimistic, but you know, it's possible. Broadband is an issue in many parts of our county. We have some people that tried to work from home but just couldn't because they didn't have the bandwidth to do it. May 1st, our courts are going to a Zoom type of hearing format to try and bridge the gap until they can have people in court again. We'll see how that goes. They're doing a trial run. Luckily, being a small county, we're able to do some things that the larger counties can't. That's a blessing sometimes. We would hope that the state agencies would think about relaxing some of the deadlines and other things if the need be, while we're all coping with, because some of these deadlines that we face in many different areas of the state agencies are hard and fast. So we would hope that if there was a need, they would consider relaxing those. Testing, I think, is an issue for us also. Our economy relies heavily on an influx of people from not all over the state, but all over the country and sometimes the world. If this, you know, I mean, I just don't know what to tell our hospitality industries. You know, we have asked them to close because everybody and their dog thought it was a good idea to come to the coast on May 19th or what, you know, that week. And we don't know when to tell them to open up. We're afraid of what might happen because our beach community is predominantly retired. We have a large levy shift that goes to senior citizen exemption in the county, which in which they've deserved, but it impacts our revenues. It's, you know, we've got, you know, like other counties, our share of catch-22 is if this had happened in 2017 at this time this year, when we didn't get any money in our first quarter timber allotment, we would have had to have laid off about half our staff. We're really lucky that we've had a good sales tax year and a half or so behind us to build up a little bit. And that's the only reason we're not just scrambling. And I guess that's it. Thanks.
Thank you. Appreciate it. So we do have a few minutes left. That's awesome. Thank you. I have been scrolling through the questions in the chat box, and I think for the most part, we have addressed the revenue issue. I would point out that Representative Paulette is on the line, and he tells us that they are looking to ask the governor, some legislators are looking to ask the governor for some revenue flexibility for you all, as well as potentially some legislation that could do that for a couple of years. And I think that's fantastic. As you know, you have a lot of parameters around a lot of your funding, and it's very limited. And so any flexibility with existing revenue to put it where you need it most, I think is very great. So we really encourage that, and thank you. I want to be able to address the medical questions that are on here, but before we go to that, are there any questions that we have from any legislators on the phone or on the webinar, right? Video, whatever this is. Okay, I'm not seeing anybody chime in, and of course, feel free to do so at any time. And if we don't cover it today, then hopefully you know where to find us, and you can ask us at any time. There are a lot of questions in our chat box about testing and the availability of supplies. When might hospitals be open for elective outpatient surgeries, et cetera? Maybe Dr. Melnick, you could give us kind of a summary overview, last words on all this stuff. Not to put you on the spot or anything, but.
No, actually, I've been waiting. I've been chomping on the bit to respond here. A lot of the questions have come up with antibody testing. So, and actually I addressed this in our Board of Health meeting a couple of days ago, but I'll be as quick as I can here. So just a couple of definitions here. Antigens, those are the tests that we've been doing. Antigens are the organisms that attack our bodies and cause disease. And that's what the testing we've been doing so far. The antibodies are chemicals that your body produces to fight a disease. And actually, you know, antibodies being able to test for antibodies has great promise. We could use it if we had an adequate antibody test, which we don't have, which I'm going to talk about in a minute. It could be used for identifying who's had the disease, who's been infected. So give you an idea of the distribution of the infection in the community. And it also could be used to help determine when somebody was immune, if the issue about what levels of antibody you need to be immune. That way we could get people, especially in high-risk settings, back to work. We used that during the measles outbreak. You might recall when we had excluded teachers at schools where there were outbreaks, there were measles cases, and the teachers who didn't have data on whether they'd been immunized or not, they ended up getting the antibody test. And by the way, the test for antibodies is called serology because the antibodies kind of hang out in the serum, which is part of the blood. We were able to get antibody tests on them, serology on them, and if their levels were high enough, they were able to go back and work in school. Here's the problem with antibodies. There's several problems with serologic testing or testing for antibodies that is definitely not ready for prime time yet. One is these tests have not been been validated. And one of the problems with these tests, with these serology tests, is what we call a low specificity. And the problem is that the antibody tests that currently exist have a difficult time distinguishing between different types of coronaviruses. Coronaviruses are really common. They're a cause of the common cold. And if you tested many of us, we would have antibodies to coronavirus in our system. The problem with the tests that are available right now is that they have difficulty distinguishing between COVID-19, actually the SARS-CoV-2 virus, you know, infections due to that, and garden variety coronavirus as a cause of common cold. So if you were to test a population, you'd get a lot of false positives because you'd be seeing people who had, you know, garden variety coronavirus, which is many of us. Another problem with the antibody tests is that they really, especially, you know, with early phase antibodies like IgM, you can't tell whether somebody's actually contagious or not at the time the test is done. We don't have validation of the level of antibodies that you test for and whether you're immune. So I can't do a serology test on somebody now and as a physician and say, oh, here's your result, that means you're immune. There's no way to say that right now. We don't know, this is too new, hasn't been studied. We don't know the correlation between actual antibody levels and whether you're immune or not. We also can't use it to identify who donors might be. There's been a lot of issues around, well, if we could identify people who had antibodies, they could be donors and we could use their antibodies to treat patients. Couple of problems with that. One is we need to do clinical trials because there's actually some evidence or some concern. This was in an Infectious Disease Society of America document that said that, you know, without clinical trials, antibodies might actually do more harm than good if they could. You know, I think we've begun to realize that a hyperimmune response, and you've heard of cytokine storm, can actually increase the chance of death in people with COVID-19. We can't use it to make clinical decisions. Again, I can't use it to say somebody's safe to go back to work. So, you know, there have been some studies. There was a Stanford study that people are mentioning. The Stanford study is flawed in several ways that I don't have time to get into. The bottom line, I love serology. It may have uses, but it's not ready yet. I wish it were. I wish we could use it, but right now it's not ready yet. And I'd hate to see us spending our resources on trying to use it when the information won't be helpful, and we need to spend all the resources we have in terms of fighting this pandemic right now, including whatever financial resources we have. So I'll leave it at that. Sorry for the long-winded response.
Well, and it wasn't very uplifting either, to be honest with you.
I wish we had it, really. I mean, it really has promise, and we used it for measles, but we're not, you know, and eventually it'll be really helpful because when we do vaccine trials, we'll be able to use the results of the serology testing to see if the vaccines can, make you immune. But we're not nearly there yet. I'm sorry. And I can't see, you know, we've been talking about budget and finances. I can't see spending a lot of money doing this. The last thing we want to do is throw money down the drain right now. So I think we need to know, use the science, and we know what's effective.
Yeah, and I think we're so used to instant gratification in our society now that science just doesn't move fast enough when we want it to. But thank you for all of your hard work and really helpful information from Dr. Melnick. And in fact, Representative Paulette says that was the most articulate and understandable discussion about that he's heard. So that's fantastic. Thank you. I will just close by saying that please, all of you, any of you on the phone, don't hesitate to sign up for future of these webinars if you're interested. It does not matter if you're from the county or not. And also, if you have any questions about anything, COVID related or not, please don't hesitate to reach out to us. In terms of just from the association perspective, I don't think any of us thought we would be as busy as we are, but we are really trying to be a conduit of information to our local governments, not just the commissioners and councilors and council members, but also the planners and the engineers and everyone else. So we've been having conference calls. There must be probably a dozen a week where we are meeting and talking about all of these things. So if you have a particular question about how is, whatever happening, we can probably find you an answer. And again, I just want to thank everyone for taking their time. This is so unprecedented and it's so unreal, and being able to touch bases like this and communicate and know that we're all in it together, I think is really helpful. So appreciate the support from the legislators, and appreciate all the hard work everyone else is doing as well. So thank you very much. And with that,
Melanie,
yes,
Melanie, this is Representative Monica Stonier. I just have a quick comment to double up on what Dr. Melnick just had to say. I mean, we are obviously very concerned about the financial state that our counties and cities are going to be in. And I know, you're talking about the investments that are going to be necessary and how we should be approaching our budget when we go back for special session to reevaluate. I think Eric's comments about mental health challenges as a result of this are going to be certainly at the top of mind. But the state will also be going back to cut budgets. And so, it's important to remember that when we're talking about where we're going to be putting resources, to be careful about putting resources where we're going to get the results and the investment that we need to be a resource for counties. That will mean we'll have to be certain that when we're investing in different types of whether it's antibodies or any support that we're going to need, we have to be careful about doing it in a way that's going to get us the results that we need. So we will not have the resources to do exploratory procedures or assessments on different antibody things. So I just want to put that in context, that the state will be dealing with the same discerning decisions around budgets as each of you will be at the county.
Great point. I know it's something that we're all worried about, is on top of the losses that the counties will suffer. We just would make the plea that the legislature doesn't make it any worse on them, but you raise very valid points. I think we're all really worried about what that's going to look like in the future. We had a question, are these being recorded? Yes, they are. We will have a link online to all of the recordings at wasac.org. And we also will email those of you who were on this call a copy or a link to the PowerPoint, a link to the webinar itself, and also meeting notes. So it'll take us a day or so to get it all summarized and back out to you, but that will be on its way shortly. So absolutely, it'll be available for you to look back on if you need to. So thank you. Thank you again for everyone's time. Really appreciate it very much. Have a great weekend.